The amount of views on my last video, excellent, considering it's my third tier channel. I only had 200 subscribers, so it got over 5,000 views. And as you can see, this is the analytics. They're external, so people are sharing that video and the information, and it's really important. So yeah, many thanks to those people that have shared it and got it out there. And I'm still getting this problem. I'm seeing comments in my notifications, but then they're not making it through to the video itself. So that's not me blocking it, that's YouTube. And from this information that Tony gave, I managed to find the actual source data, the source articles. I'll post a link to that in the description. Now, people mentioned that the documents I was going to prepare, when are they going to be ready? I'm going to have them by next Tuesday. I'm going to do it how I've done it before on my other channels, where I'll just load it up to Google Docs and put a link for people to then download the documents. As far as the content of them, there's certainly going to be an individual one. I think we need to each individually send something off to the health department, to the certainly to the government, and even to the army, because I dare say you're going to have to withdraw your consent from that legislation for them to come to you, as well as rejecting the poison that they're going to try and jab into you. So that, yeah, you got to withdraw your consent definitely for those things. That's what it comes down to. So in this video here, I'm just going to run through what this clown reiterates about how their tactic is that 25 million people are going to be getting this thing, and they're not backing down from that. And I've mentioned before, they said it's not mandatory, but at the same time they're telling us that we're going to be getting it, because that's their double speak they've got going. So we can't just sit back. Eventually they're going to the process are going to have invitations out, then they're going to try and coerce you. You can't go to work. Eventually they're going to have these guys go around to people's houses. That's what they're going to do. Because their plan is that everyone gets this poison, and we're going to have to meet them. We're going to have to walk out to meet them. You can't wait for that to eventuate. We need to you need to prepare and have a witness document that you don't consent, and you're not going to have them come to you and force this stuff onto you. And everyone's in agreement on that. I'm really heartened by the comments. People are really determined, and hopefully we can get this information out. So next Tuesday, I will have prepared some documents. Just as far as the legality of them, I'm just using templates from legal websites. Now, if you want to get a lawyer or a legal representation, you might be able to. But look, the problem the legal industry's got is the same as the medical industry. They've got the medical industry's got the AMA, and they can deregister doctors that don't play ball. And I think the Bar Association in each state can do the same thing to lawyers. So, but look, anything can be a contract, really, even on butcher paper, as long as it's signed, dated, witnessed. That a contract can be written like that. You can make it legal and enforceable. So that's what I'll endeavour to do as far as the content, and I'll be very specific with the wording to make sure there's, the best I can, there's no kind of workaround. But again, people can edit themselves. I'll do word versions as well. So that's for next Tuesday. So all right, let's get into this one.
We've still got more than 1,200 people around the nation doing predominantly support to quarantining.
This was an interview on the Today Show with Karl Stefanovic, and what this clown's talking about is how early on they had them out doing quarantine work, and even the bushfires, they had them out for that, but that was under the Defence Assistance to the Community documentation, nothing to do with any enforcement. But that was to condition people just to get used to seeing in public places people in military uniforms.
But we've been asked to also provide some assistance to the Commonwealth Department of Health, just to be ready to help with the rollout if necessary. We've already put some people in to help with planning and coordination in the Department of Health here in Canberra, and we're putting together some vaccination teams who may be called on to help with the rollout if required. Our health teams at the moment are doing some refresher training, but they're specifically learning about administering the Pfizer vaccine right now.
There's a contradiction in what he says there. So they're always saying we may be called upon, if required, making out like this hasn't been already worked out. Well, of course it has. And they've got their medical people are learning specifically about the Pfizer jab. Well, if they're already medically trained, that would be like a half-hour workshop. They don't need weeks and weeks of advance. So they're doing it now because they're going to be hitting the ground and going straight after us.
The plan is starting to unfold, and again, we're just standing ready to help if necessary to get those vaccines to the most vulnerable where we can. And I'm confident here that once this vaccination plan gets into full swing, it will be impressive and it will get vaccines to where they need to go. Yeah, look, this is a massive national undertaking, getting vaccines to trying to get vaccines to 25 million Australians.
Again, we have another government official, just an officer this time from the army, and he's just stating that 25 million people are going to be getting this thing. No dialogue, no conversation. Remember how everything, we always need a conversation. Well, when they're going to introduce something new, they've already got something planned, but there's no conversation with this. They haven't asked anybody. They haven't made orders depending on any responses. So these things are going to waste, and that's going to be another one of their coercive tactics. So again, it just comes down to stating that everyone's going to get this, and then unless you get the opportunity, unless you say no, and they're going to try and deny you that opportunity to say no, according to them, they've got your implied consent.
I suppose you all have to have your injections too, right?
We will. I'm looking forward to that opportunity, but we will stand in line in accordance with the priorities, and at the moment, the aged care sector and the disability sector is where we need to get those vaccines too.
Now, all they've talked about as far as the queue to get this jab was that frontline workers and first responders would be the first to get it. Well, isn't their teams now becoming first responders? Shouldn't they be getting it? Well, of course not. And you can be absolutely guaranteed this guy and none of his family or anyone that's close to him is going to be going anywhere near this jab. He'll have some medical reason. They'll all be magically, they're anaphylactic, we can't take it, we wish we could. Same thing's going to apply to Karl Stefanovic and all of those people on the other side of the fence to us. All right, so that's pretty much it for this one. So my next video, I'll have the links to the forms, and I'll also have an explanation. And I've researched all this as far as implied consent goes and the law, and I'll just explaining parts of what I've put into these forms to make sure it's as watertight as it possibly can be. And then you've prepared yourself, and you've gone out and you've approached them. They don't want to hear that they haven't asked any questions. Well, you need to tell them the answer without them asking the questions, and you need to have a legal document and confirmation that they know that you've served it on them, either through the mail, registered post. Again, I'll have all that. Might be a case just walking up to dropping it off at the local police station. Copies everywhere. And film yourself. I've served this, and that is a legal document. It's a letter. Now, but even if they choose not to open it, well, we're rejecting it. It doesn't matter. The same as if you get served something from the court, as long as they follow their protocols on what constitutes something being served. You can say I didn't read it, but if it's on your property, or they've given it to you, there is a legal compulsion then for you to there's the understanding that you know that it's been served on you when you know about it. And that's a principle we're going to use on these guys. I don't care how much they've got their hands to their ears, not listening. 25 million people are getting it. Absolutely no way is that going to happen. And I think they've jumped really early on this military thing. Maybe a lot of the first responders who haven't turned up for work have gone, I'm meant to get the jab today, I'm not going. Maybe that's why they've called these guys in so very quick, or they knew that's what would happen anyway, because, I reckon the longer this goes, they're attacking the elderly at the moment, and, hopefully people are defending them, their loved ones, but we also got to defend ourselves. Now, that's pretty much it for this one. So next Tuesday, I'll have those documents ready to go. If not by the end of next week, definitely. I'm just going to finish off and show you some of the more propaganda that was included in this interview. And it's that theme they've got where that everyone must worship the first responders and worship this guy. Listen how sickening it all is. When, first responders, hospitals are empty. They were busy making music videos. There was a big one made by one of the Queensland hospitals, and I did a video on it. I can't find it anymore. So I think they've pulled a lot of them because they weren't busy at all. And if you look at the hospital and ICU numbers in those health at a glance forms you can still find online, the hospital, nobody was in hospital with this thing. Remember the video I put up where Brad Hazard got asked by that reporter during the Narrabeen outbreak, and he said, how many people are in hospital? And he's like looking around, oh, shoot. So, yeah, all right, that's it for this one.
What a remarkable 12 months it's been for the ADF, for bushfires, hotel quarantine, now aged care vaccinations. You must be incredibly proud of the men and women who serve this country.
Yeah, well, Karl, again, massive effort all through the year. I'm very proud of our ADF folks and I'm very privileged to be leading them, but I also want to call out all of the frontline health workers around this nation. I mean, they are the ones that have been doing this day in, day out, and I am in awe of their efforts, so a big shout out to them. But we come to help where we can, and we work very closely with all of our partner agencies across the states and territories, and we've got fantastic relationships with all of those folks as well. And I'm confident here that once this vaccination plan gets into full swing, it will be impressive and it will get vaccines to where they need to go to.
You wouldn't hear this very often, but I'm in awe of you and your leadership and also of all of our ADF. A remarkable job in the most trying of circumstances. Thank you so much for your time today. Really appreciate it and good luck.
Thanks very much, Carl.
Okay.